Hello dear learners, today we are going to discuss the anatomy of the heart from cardiovascular system. So to talk about the anatomy of the heart from the content wherein in our last video we have gone through the introduction to the cardiovascular system. So the next part, which is anatomy of the heart, we are going to see in today's video. So I'll be covering it in detail, but before that, I will request you all to go through the first part, that is introduction to the cardiovascular system. So the step by step content you will get. Then to start about the anatomy, if you look into this diagram, this is a diagram like this picture is showing you the gross anatomical features of the heart, okay, exterior features, okay, external features, wherein if you will start now, this part, this broader part is known as the base of the heart, and the pointed sharp pointed thing which is nothing but the apex of the heart. Okay, so base and the apex of the heart, okay, wherein above base you will find the first feature, that is nothing but an aortic arch, which further subdivided into various arteries like carotid artery, subclavian artery, bronchocephalic trunk, which will provide the oxygenated blood to all the parts of the body. Since you can see this is red in color, and since this is an artery, it is carrying the blood away from the heart. Artery ka A, away ka A. Okay, so this artery is carrying blood away from the heart. And then the next feature, like if you will see, this is the pulmonary artery, which is joined with the aorta with the ligamentum arteriosum, wherein you will see this is actually this region which is originating from the heart. Okay, it is from the right ventricle. Okay, so this is the pulmonary trunk, which further subdivides itself into the left pulmonary artery and the right pulmonary artery. Now, though it is artery, you will say why it is blue in color then, since arteries carry generally the oxygenated blood. The reason behind this is the exceptional artery which carries the deoxygenated blood towards the lung, okay, for oxygenation. So this is pulmonary artery. If you will go further down, these are the two atrias, okay, right and the left atrium. Though it is your right, in introduction, that is the reason I am telling you people, in introduction you first go through that video, because in that we have covered how to read the labels or how to how to judge this diagram, like this left part, okay, though it is our right, this is right part, though it is our left. Okay, so these are the atrias. Then if you will go down, so this is the left ventricle and this one is the right ventricle. And if you will see this network, okay, this network of the blood vessels, it is nothing but this is providing the supply of oxygen to work, like to for the efficient working of the heart. So what are these structures? If you will see these red colored structures, okay, this one and this one, so these are nothing but coronary arteries. This one is the right coronary artery, okay, which is supplying the blood as well as oxygen to the heart muscles. And then this is the left ventricle, wherein you will find this is the left coronary artery, which is supplying the blood and oxygen to the heart muscles for efficient working. If you will see the next features, these are the again blue color blood vessels, which are known as superior vena cava and inferior vena cava. Okay, these are the again largest veins of the body, as the aorta is the largest artery of the body, largest blood vessel. Okay, you can call it as largest blood vessel. These are also largest blood vessels, veins which are carrying blood, deoxygenated blood from the body to the heart. Okay, so this inferior vena cava, since it is inferior, it will carry blood from the lower abdomen. Since it is superior vena cava, it will carry the blood from the upper abdominal region. Okay, then the four things, Okay, these are the 4 things like which are remaining. Now these are the 4 pulmonary veins. Okay, right pulmonary veins and the left pulmonary veins. Okay. Now definitely, as per the discussion we have seen, arteries carrying blood away from the heart. Artery ka A, away ka A. Okay. And the veins, like herein you can see this is the artery. Now since these are the veins, again these are collecting the blood to the heart, okay, from the lung. That is the reason the name is pulmonary vein. Okay. And the pulmonary artery. Pulmonary is to deal with the lungs. Okay. Artery is carrying blood away from the heart. So it will carry the blood to the lung, and veins which are carrying blood to the heart. So pulmonary veins are the veins which are carrying blood from the lungs to the heart. Okay. If you will look into the anatomical features, the shape, size, weight. Okay. Approximately if you look into the shape, okay, what you can find, this is the roughly cone shaped hollow muscular organ. Heart is nothing but a muscular organ. So size क्या है इसका? It is about 10 centimeter long and of the size of the owner's fist. मतलब खुद के fist का size जो है, it is of that size. Then weight, it is approximately 250 mg in women and 250 gram in women and 300 gram in men. Okay. So this is an approximate estimate. This can vary from author to author. Okay. Next, if you will see the position where it is like this was the only diagram. Okay. But where it is placed in the body, so if you will see the position, it is basically in the thoracic cavity. Okay. In the mediastinum between the lungs. Okay. Mediastinum. Okay. In between the lungs. If you will see, these are the ribs. Okay. If you will see, these are the 2 lungs. Okay. And this is the cone shaped muscular organ, which is nothing but heart, which lies between the thoracic cavity. Okay. Mediastinum between the lungs. Okay. In between the lungs. Next is location. Location mein it lies obliquely. It is not straight. It is obliquely, as you can very much clearly see in the diagram, the yellow color highlighted part. Okay. Little more to the left than the right. So as we have already discussed, though this is our right, this is left. Okay. So it is little more towards left side. If you will see, it is tilted. Okay. It is more towards the left than the right side, and presents a base above and the apex below. As discussed earlier, this is the base which is above and the apex which is below, which is resting on the diaphragm. Okay. Next part, if you will see, it extends from the sternum to the vertebral column. That means if you will see from आगे से this part, whole part is the sternum. Okay. If you will see this sternum and the back side, if you will see the vertebral columns. Okay. So it lies. Okay. It lies between these structures. Okay. Front and the back. From the first rib to the diaphragm and between the lungs. मतलब first rib से start होके ये डायफ्राम पे रेस्ट करता है, इसका एपेक्स, एंड इट इज बिटवीन द 2 lungs. Okay. Next part, if you will see, the base extends to the level of the second rib. मतलब upper part, base. Okay. Base कहाँ पे होता है? If you will see this, okay, this extends to the second rib. Okay. And the apex is about 9 centimeter to the left of the midline at the level of 5th intercostal space. Now, what is intercostal space? Okay. So, this is the space between the ribs. Okay. So, if you will see here, like from first, it carries towards the 5th one. Okay. The position. Then, it is slightly, that means it is little below the nipples and slightly nearer the midline. Okay. मतलब बीच में होता है and it is slightly nipple के थोड़ा नीचे. If you will see the position. Next, if you will see, these are the organs associated with the heart. If you look into the organs, first you need to understand this. Superior, inferior. Superior means upper region. Inferior means lower region. right side and the left side. Okay, so this is nothing but you can call it as laterally. Okay, then posterior, then the superior. Okay, superior is the upper region, and the little one, this posterior, is nothing but from the back. Okay, and inferior is nothing but from the below. Okay, here you cannot see the posterior region, only superior, inferior, right and left. Okay, so the superior, what you can find now, see what is the meaning of superior. It is from the upper part. Okay, so if you look into the diagram, heart के ऊपर क्या था exactly? It was aorta. Okay, then the next thing was superior vena cava was there. Then exactly below the aorta, pulmonary artery and pulmonary veins were there. So all these things are only there in the explanation. You need not to buy heart. सिर्फ आप लोगों को structure visualize करना है कि heart के ऊपर क्या है. All blood vessels are there. Aorta है, superior vena cava है, pulmonary artery है, pulmonary veins है. Then posterior. Okay, मतलब from the back side. So if you will see posteriorly, तो posteriorly क्या क्या है? Food pipe है, wind pipe है, मतलब ही esophagus है. See, you can see here esophagus है, then trachea है. Okay, these are the two pipes. This one is the trachea and this one is the esophagus. Okay, esophagus is known as the food pipe and trachea is known as the wind pipe. Okay, left and the right bronchus. Okay, then next if you will see last मतलब back side से it is descending aorta, inferior vena cava and thoracic vertebrae. मतलब जैसे कि हम लोगों ने बोला कि सामने से ये sternum and from the back side thoracic vertebrae मतलब vertebral column के region तक ये extend करता है. So definitely posteriorly vertebrae तो होंगे ही. तो कौन से vertebrae amongst the vertebrae? These are the thoracic vertebrae. Then inferior vena cava is there and the major are esophagus and the trachea. And superiorly ka, if you will see the diagram, the very first diagram, see, as you can see, aorta hai, pulmonary trunk hai, superior vena cava hai, pulmonary veins hai. Okay, so this was about the superior and the posterior. Next if you will see the inferior. Okay, matlab from the below. So the apex rests on the central tendon of the diaphragm. See, if you will see here, this part wherein I have highlighted. Okay, this is the diaphragm. It rests on the central tendon of the diaphragm, the apex of the heart. Okay, next hai laterally. Laterally matlab from the sides. So definitely, as you all know, left lung and the right lung. Okay, so the lungs are there laterally. Okay, which are supporting the heart, or in between the lungs the heart is located anteriorly. Okay, anteriorly क्या है? तो if you will see these ribs, okay, the sternum मतलब ये सामने से sternum coverage देता है. Then the ribs are there and the intercostal muscles. मतलब क्या कि only ribs. अभी ये जो intercostal spaces हैं, in between that there are the intercostal muscles. Okay, so anteriorly कौन support कर रहा है? मतलब सामने से sternum हो गया, ribs हो गए and the intercostal muscles. Okay, so this was about the anatomy of the heart, wherein we have covered all the labels. Okay, external features only we are supposed to see in the anatomy. Okay, because we have a separate video for the internal features of the heart. Okay, internal structures. Then wherein we have covered all the matlab positions like anteriorly, posteriorly, superiorly, inferiorly, laterally, what is present. Okay, what is supporting the heart and the complete structure, all about the shape, size and weight. So here we finish with the anatomy of the heart. Thank you for patient listening, and we have the YouTube channel also, wherein you have the paid membership too. With the join button you can join us starting from ₹29 per month, and again you have a free access to all the videos too. Okay, then we have our website also, wherein different contents are being given, and you can visit to our Insta, Facebook page also. Thank you.